everybody, as a medical practitioner, we must know all the components of history taking. It is very important in diagnosing the diseases as it helps for the management and the treatment for the patients. There are 10 components of history taking. Remember, always introduce ourselves before we start. The first component is the present complaint. Next, the history of the present complaint, also known as history of present illness or HOPI. After that, ask the patient the remaining questions of abdominal system. Then we have to review the systems.
Next, asking about patient past medical history. Ask about general first, like have you ever diagnosed with any medical conditions, and then focus on GI related conditions. We can also ask about systemic disease that can affect GI tract. For example, like you have autoimmune disease like SLE that may involve liver, bowel or pancreas. After that, ask patient about their past surgical history. General first, have you ever had any operation or procedure done before? Ask about follow-up details after surgery. For example, when was it done, why it was performed, complication after surgeries. Tips: always check for surgical scars during physical examination as it can confirm for the diagnosis. Ask patient about their drug history. Ask about taking any medication regularly or recently as it can cause or mask the GI symptoms and also cause some irritation. Ask about their allergies and drug reactions. Example, are you allergic to any medications or what happens when you take them?
About immunizations, we will check if you have had your vaccines like measles, tetanus or flu shots. This helps us make sure you are protected from certain diseases. Next is your family history. We will ask if anyone in your family has conditions such as diabetes, high blood pressure, or heart problems. This helps us see if you might be at high risk. Lastly, your social history. We will ask about your lifestyle, if you are smoking or drinking alcohol, what kind of work you do, where and who do you live with. These things can affect your health too.
First of all, I greet the patient and introduce myself. Then I explain that I will perform an abdominal examination and obtain consent. After that, I expose the abdomen from the nipple line to the symphysis pubis. On inspection, the skin shows no scar, striae, or abnormal pigmentation. The abdomen moves symmetrically with respiration and there are no visible dilated veins.
Inform the patient that you are going to do the procedure and take the consent. Tell them that you will start by gently feeling the abdomen and ask them to let you know if they feel any pain. As for the technique, use flat fingers of your right hand and palpate all 9 regions of the abdomen systematically. Start from right iliac fossa. While doing the palpation, make sure to look at the patient's face for tenderness or guarding. Next, proceed for deep palpation. Make sure to inform the patient that you will press a bit deeper to feel for any structure or muscles. As for the technique, use both hands, right hand pressing the abdomen while left hand on top for support. Again, go through all regions systematically.
Today I'm going to do a percussion for abdominal examination. When I start the percussion, for general percussion, I do narrigid abnormal percussion. And then we proceed for the hepatomegaly to check the abnormal or enlargement of hepa. For the last percussion, I will do a splenomegaly to check the abnormal or enlargement of spleen.
Next, auscultation. Make sure you wash your hands and wear PPE before touching the patient. Start introduce yourself to the patient including your role and briefly explain what the examination will involve. Gain consent again to proceed with the examination. Warm the stethoscope before use. Start listening for bowel sounds in all 4 quadrants. Begin in the right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. Then, assess for aortic broods. Assess for renal artery brood. Thanks the patient and document the finding, including the pitch, intensity, and frequency of bowel sounds.
Before starting, I will expose patient adequately. First test is for the Gaussing sign. Palpate the left iliac fossa, and if the patient complains pain on right iliac fossa, then the Gaussing sign is positive. Next, rebound tenderness. Do palpation on right iliac fossa and release quickly. If patient feels more pain when I release my hand, rebound tenderness is positive. Lastly, the psoas sign. I will ask patient to raise his right leg and I will push down to his leg. The result is positive if patient feels pain when raising his leg. Next, in psoas sign, I will ask patient to lie laterally and flex his knee backward while I hold on to his hand. The result is positive when patient feels pain on anterior thigh.
Next, I will do explaining about special tests of ascites by text. If